Well, hello there. I am Dr. Gary Huber. It is hump day. It is Wednesday, baby. It is 3 o'clock. And if this is the first time you're joining us, welcome. And if you've been following us every Wednesday, welcome even more so.
Welcome back.
Welcome back. Thank you. So this is Chelsea Cato. I called you Keto.
That was the first.
We call her Keto
yes.
because she's always teaching the ketogenic diet. And we've already had that discussion, but this is Chelsea, my partner in crime, and we want to have a really cool discussion today about Lyme's. It is all over the place, not the disease necessarily, but the discussion and the talk of it. It's all in the news, and we want to talk a little bit about that. We want to help arm you with some ideas about how to protect yourself, and we want to really deflate the myth. There's so much garbage information out there, and people go on the internet and they read about Lyme's, and they're just panic-stricken.
Absolutely.
And there's reason for concern, but we're going to go through some of the facts and really dispel a lot of the myths, because there's a lot of myths out there. So we asked some people for their questions this week. We said, hey, what questions do you have about Lyme?
Quite a few.
And we got quite a few. We're going to answer those.
I would say the biggest thing is people just want to know, what the heck is it? What is Lyme, and does it have anything to do with ticks and deer? And I think that's the biggest question, is what is it?
Lyme is a green citrus fruit that I used in my margarita.
And done, we're done.
We're done. Thanks for tuning in.
Thanks for tuning in.
But Lyme's disease is a particular type of bacterial infection from a bug called Borrelia. It's named Borrelia burgdorferi, and that's because the gentleman that found it in 1982 was Willy Borgdorfer. Now, how'd you like to go through life with that name? Willy was a researcher. Willy found Borrelia, and Borrelia burgdorferi was named after him. Well, there are over 100 different species of Borrelia, and at least 13 of them are pathogenic, and that's going to be an important detail. We'll come back to that again. You don't have to memorize it. There's no quiz. But because Borrelia is the bacteria that causes Lyme. But Borrelia is almost always associated, when you get Lyme's disease, you almost always, greater than 95% of the time, have other co-infections that tag along with it. We'll detail that a little bit, because Borrelia will weaken the immune system. And so what is Lyme? You hear the word ticks, and it's a deer tick, and what is all that about? It's really quite simple. So there are two basic hosts for the Borrelia bacteria. It exists in deers, and it exists in mice. The ticks bite the mice or bite the deer, and then they hang out on tall grasses and they wait for you to walk by.
Or my dog.
Or your dog. And they jump on you or your dog, and then they're on you, and when they bite you, they can give you the infection. All right? So that's the connection with deer and mice and ticks.
Okay.
And it isn't all ticks, because ticks have a life cycle. You know, they're eggs, and then they're born and they're babies. But it's the nymph. Chris is going to put up a picture of beautiful ticks, and those of you that are squeamish,
And
don't
they're
look.
so tiny.
They're so tiny.
Yeah.
So look at those 4 ticks. There's the baby on the far left. The next one in is the nymph. The nymph is the most active. That's less than 2 millimeters in size. And they're all active right now. In fact, May is Lyme month, because they're very active in May, in June, and into July. Those are the most active. The 2 bigger ones is the male, and then the largest is the female. They're a little lazier, than the nymphs. They're not as active. They become more active in the cooler fall months, but they're not nearly as active. So most of the Lyme, when we're worried about it, is coming from these little nymphs, and they just hang out in the grass. And then when you walk through a field or you get near them, they're hanging on with their back legs, and they see you and they just grab you and hang on. And then they try to bite and inject their element into you.
So I saw last night on the news this whole special on ticks and how to get rid of them. From your standpoint, and to protect you and your family, how are you going to reduce the ticks in your backyard?
Excellent point, because we live near the woods, in the woods, and a lot of people do, or you live near a park, or you just go to a park. But if you live near woods and you want to reduce the tick population, you can do something called tick tubes. That's what they're called.
Tick tubes,
you
write it down.
You can go on Amazon and you can buy tick tubes. Now they're $5 a piece, and the whole idea is you take these tick tubes and you put them in the weeds or the periphery where the woods are, and what's in there is permethrin, which is a pesticide. It kills ticks. The ticks aren't going to eat it, but the mice are going to go in that little tube and take little fibers out of there and take it back and build their nest. Now, rather than spend $5 on tick tubes, you know me, I can pinch a penny, baby. If you live near woods, we're going to put this in the show notes afterwards, but save all of your toilet paper rolls. Save all of your toilet paper rolls and all your paper towel rolls. And save your dryer lint, okay? Sounds crazy.
Ooh,
You're going to buy
gross.
permethrin off the internet, very cheap, and we'll show you a video on how to do this. You're going to spray it on the lint, shove the lint in the tube, and put the tubes in the woods. The mice find the tubes and they go, party! And they find the lint and they take it back and they make their nest out of it.
Wow.
And it gets into them. And now when the ticks bite the mice, instead of getting Borrelia, they get dead. Okay?
I like
because
that.
the permethrin in the mice kills the ticks. So that's the first thing I would do to protect your property.
Deticking your property, basically.
Deticking your property as best you can. The other thing is when you go outside and you play in the woods, check your dogs, check your kids. I mean, head to toe, you really got to check. Remember, that's a 2-millimeter nymph tick. It's tiny, tiny, tiny. And you're looking for these, and you want to go through the hair, obviously, but just scour your pets, scour your kids.
So is there something you can spray on you? I mean, should you use off, or should you use...
Idea. You know me, I don't like chemicals, I don't like toxins. So these are two things that we've used.
Okay.
These are organic. It's called Ticks and All. And there's a spray bottle or there's a convenient little pen for you ladies to put in your purse when you're at the park with the kids. But these are all organic, all natural, no chemicals. But there's tons, there's 12 different oils in here. So there's peppermint oil and rosemary oil and coconut oil and a whole host of other oils. And these things, they smell nice, they don't feel weird, and they don't smell weird unless you're a tick or a mosquito or a horsefly.
Wow.
So this is a general insect repellent, but it's specifically formulated to repel ticks. So this is how we protect our kids when we go out.
Yeah.
And then we protect our yard with the tick tubes.
Especially, I think, if you're camping or hiking. I mean, I feel like a lot of our Lyme patients, they always say, oh, I'm big outdoorsy people, and I'm, on the river and camping all the time, and it's just...
You feel like you're in prison. I can't go to my campsite. I can't do my hiking. And we don't want you to feel that way. So protect yourself with this.
Yep.
Protect your ankles and stuff. You can put your pants inside your socks, and people sometimes tape that. There's all kinds of different things you can do.
Yeah.
Mostly just scour your body for the ticks when you get home. It isn't that the tick's going to bite you on the hike and then jump off of you. We worry when the tick bites you and it digs in and it stays there. That's when your risk of transmitting the disease heightens. Okay. So don't worry if you go in the woods and you come home and you see a tick crawling on your arm. If it hasn't embedded, the odds of having contracted Borrelia is very slight, very less than 1%.
So flick it off and crush it.
Flick it off and crush it. Now, if it's bit you, we don't know how long it's been in.
Yeah.
I'm going to be very proactive.
What would you do?
I'm going to take an antibiotic.
Yeah.
And anybody that knows me knows I'm not real big to jump on antibiotics in a hurry. But when you look at what can happen to you with Borrelia or Lyme disease, man, a few weeks of an antibiotic is well worth.
I'll take the diarrhea.
If I get diarrhea, if I get a yeast infection, I'll take that. I don't want the risk of getting Borrelia. The actual risk, if you have a bite, is probably still less than 1.5%.
Wow.
I want a 0% risk.
Yeah.
I don't accept that risk. It's a nasty infection.
There's literally a deer right outside our office. Look, Dr. Huber,
Oh my God!
this is the craziest thing. There's literally a deer. Can you guys see that
We're
right now?
We're talking about you.
Get rid of you, ticks.
Look at he's right there.
That's crazy.
That is crazy. So
Sorry.
you tell me, oh, I don't have to worry. I don't live in the country. You don't need to.
Exactly.
Right? They'll come right to you.
We'll pay that deer later. So we'll talk about the symptoms later, but I want to talk about testing.
Yeah.
Lyme testing, that's another big question we got. There's so many different kinds of testing, some which are a little unreliable. What's your take on that?
It goes back to the bug itself. So there are over 100 different species of Borrelia. The Western blot and ELISA test, it's a two-tiered system in this country. The ELISA test, you could flip a coin and be more accurate. It's not very accurate. The Western blot is about a 50-50 shot. You could have 100 people with documented Lyme and test them with the Western blot test, and half of them will show up negative.
Wow.
What the Western blot is looking for, we're going to pretend that this black thing, this is actually a mouse, not a tick. But we're going to pretend this is our tick.
Computer mouse.
The tick has bands of protein around it. And what the test is doing is if this tick dies and these proteins are in our bloodstream, our immune system says, hey, you're foreign. I'm going to make an antibody against you.
Oh.
So the test is looking for different protein bands.
Okay.
Now there are 5 different protein bands that are very specific for Lyme. So people will get their test, and you have to have, according to the CDC, 5 positive IgG bands. In other words, 5 of these bands have to be positive. And the problem is people have 2 or 3, and but they won't test completely positive on that test. Here's the big problem. We created the vaccine back in 1998 for Lyme. Because of political pressures and financial issues, that vaccine, although successful, went by and by.
Really?
We found out that on this Borrelia bug, band number 31 and band number 34 were the most specific for Borrelia burgdorferi. So we use those two bands in the making of the vaccine. Because they're now in the vaccine, the CDC said, well, then we're going to take them out of the Western blot test because we don't want people that have had the vaccine to test positive for that band. When the vaccine went out of production, they didn't put the bands back into the test. So the most specific band for Lyme's or Borrelia isn't even in the Western blot test. So what good is the Western blot test?
Nada.
Right? It's not.
Yeah.
So we do it because it's cheap and it's easy and it's quick. But if it tests negative, you test negative for Western blot, you haven't proven anything.
Don't stop there.
You've not proven that you don't have Lyme.
Okay, but
right?
you could still get a positive from a Western blot.
If you get a positive on the Western blot, if you come into me with a positive 23 band or a 31 or a 34 band, but you don't have 5 bands, I don't care. That's enough that if you have the symptoms on top of that band, I'm going to be very aggressive in treating.
Okay.
Okay? And that's the other keynote. Lyme's disease, now write this down. Lyme's disease is a clinical diagnosis. What does that mean? You do not diagnose Lyme's disease with a lab test. You hope to get a lab test to show positive. But ILADS, the International Lyme and Associated Diseases Society, is the current leading mindset in how to go after Lyme. They have very smart folks. They have lots of studies. And it's the only standing accepted guideline, the national guideline that's accepted on how to treat Lyme. And they state Lyme's is a clinical diagnosis. Said differently, if you come in and you say, I have all these symptoms and I was in the woods, I didn't even see a tick and I never got a rash, but I have all these symptoms and I think it's Lyme, it's Lyme.
Wow.
Now, I will test you and I'll hope to prove it, but even if I can't prove it,
forward.
You've got to move forward. So it is a clinical diagnosis, not a laboratory diagnosis.
Wow.
So many people come in and they go, well, my doctor tested me for Western blot and he said I was negative. And he said, and you live in Cincinnati and there's no Lyme in Cincinnati.
Which isn't true.
Which is not true. You know,
Wow.
Lyme has been found from coast to coast. All right.
Wow.
50% of all counties in the United States have Lyme's disease documented. So
Wow.
we can't just say it's a Connecticut disease.
Yeah.
We can't. It's just not true. So the Western blot and ELISA are still used. I don't even use the ELISA. It's worthless. I use the Western blot because it's quick and it's easy. But if those are negative, I will go on and do an IGeneX test. And IGeneX is a test, an IgG-IgM test for Borrelia, but only Borrelia. But it's looking at 2 strains and it's looking at the 31-34 band.
Okay.
So it's better than a traditional Western blot. I'll go on and do a DNA connections test. That's looking at 3 species of Borrelia. Because remember, there's 13 different species that are potentially pathologic. That's looking at 3. And it's looking at 4 different bugs. Remember, Borrelia does not happen by itself. Lyme's disease, 99% of the time, does not happen by itself. Those ticks are also carrying Babesia and Bartonella and Ehrlichia and other parasites and other fungi and other things that can infect you. And so the DNA connection test is just that. It's looking for the DNA in your urine of all those different bugs.
Wow.
And if I see that DNA in your urine, that bug is in you.
So big picture, there are some tests that are not very reliable, but that's typically the first go-to
Because they're
general.
easy and cheap.
Easy and cheap.
Yeah.
If someone comes in...
Something you don't want to be, by the way.
Dun, dun, dun. If someone comes into our office and they've got lots of the symptoms and you have a negative Western blot, you might just continue with treatment but still go further with other testing. That
We have a lot of conversation with our patients because we don't need the positive test in order to treat you, but some patients just, I want to know.
Yeah.
And it's good to have that test. It's good to verify.
So speaking of symptoms, what are some of the symptoms? I know from some of the patients we've had, there's some bizarre and odd symptoms, and some people have said, I was told I was crazy. And, you know, with the
people feel very self-conscious about this. Look, Lyme's causes weird stuff. It causes really weird symptoms. And if you have those symptoms, I guarantee you that some docs may look at you and think you're cuckoo.
Yeah.
These are real things. Are you ready? People say, my brain feels like it's vibrating. That's real. I've heard that reported by many, many patients. My chest feels like it's vibrating. The room's bobbing up and down.
Wow.
My arms tingle, and then it goes away, and then it comes back, and then it goes away. I have an ice pick stabbing sensation in the back of my head. These are weird symptoms, right?
Yeah.
But if you deal with Lyme's patients, you find out that the neurologic system, the gut, and the musculoskeletal system is typically involved.
Okay.
So any kind of a gut issue, along with very strange neurologic symptoms. I'm fatigued. My brain can't focus. I can't even read stuff because I can't remember the words. I can't find my words.
Wow.
I'm really moody. I'm emotional. I'm anxious because Borrelia can affect the nervous system. And so people have really strange symptoms. And sometimes I really have to coax patients and say, tell me what's really going on. You can see their hesitancy because they don't want to be judged. The reality of it is it causes very strange symptoms.
And if it goes on, maybe someone could get diagnosed with ALS or
It's been documented in the literature. There are people that were diagnosed with ALS, but they didn't have ALS. They actually had Lyme's.
Wow.
People constantly, we had a patient this week. She said, I had Epstein-Barr virus when I turned 33,
Yep.
and I'm now in my 60s, and I've never gotten better.
That's a long
Epstein-Barr doesn't
time.
last 30 years.
Yeah.
And so oftentimes when people have chronic Epstein-Barr or chronic cytomegalovirus or chronic illness, they get diagnosed with chronic fatigue syndrome, fibromyalgia, rheumatoid arthritis. And I've heard this, well, your rheumatoid antibodies weren't abnormal, but we think it's rheumatoid. Said a different way, we don't know why your joints hurt, and it could be Lyme.
But we don't know.
So they get diagnosed with different things. Oh, I got chronic migraines and I have chronic fatigue and I can't sleep. These are all symptoms that Lyme's patients can have. And so it just takes putting that together. This patient had Epstein-Barr virus, lives on a farm, likes to ride horses, hasn't gotten better in 30 years, diagnosed with chronic fatigue syndrome, diagnosed with fibromyalgia, treated by 4 or 5 different docs, and feels like crap. And so I'm looking at her and I'm going,
Smells like
smells like Lyme. So we're testing it. We're going to find out.
Pictures
But she's had it for
clear.
30 years, so we're going to do some testing and try to figure out where to go from there.
So tell me about that rash. I hear about the bullseye rash.
Yeah.
That you have to have that in order to truly get diagnosed. And I've seen pictures of it, and it truly is a bullseye rash. I mean,
In a nice book where it's giving you a perfect
that's probably
example.
where I've seen pictures of it.
Erythema migrans looks like this.
Yeah.
And you'll always see that with Lyme. Wrong and wrong and wrong.
Wrong and wrong.
So erythema migrans can occur in people that have
What's it called?
Lyme's. Erythema migrans.
Okay.
Okay, migrating. And 50% of people that get Lyme's, diagnosed with Lyme's, proven Lyme's, never saw a tick, never saw a rash. If it's there, it's great. But if it's not there, you can't live by that, right?
Okay.
And the rash, a friend of mine, Sam Shore on the East Coast, he did a nice presentation and showed just slide after slide after slide of documented Lyme cases that have different rashes. Some looked like abrasions, some looked like hives, some looked like bullseye, which is the classic, but there were a host of different rashes. Some looked just like little spots. Any rash of any kind could potentially be associated with Lyme. That makes you a little nervous because you think, oh my God, is this Lyme?
Yeah.
But it has to be with the other symptoms.
Okay.
Right?
Okay.
So, yeah.
So you had mentioned that Lyme can travel with other pretty
Bugs.
serious bugs and
Yep.
infections. I don't know if we totally covered that, but what other bacteria, mold? I mean,
So-
it seems like it's this whole big ball of
It is,
infection.
because what happens with Borrelia is the smartest bacteria on the planet. It's a spirochete. So it's in the same family as syphilis. Isn't that nice?
Okay.
But it gets in your body very smart. It can change and alter. One of the cool things that it does, if you're rooting for Borrelia, is it weakens your immune system. It actually dismantles the very system that's trying to kill it. And so when it does that, now you're open for all kinds of other infections. You can get staph in the back of your nasal passage. You can get babesia. There was over 100 different species of babesia. Nobody gets babesia unless they have Lyme, or not typically, because Lyme weakens the immune system, and now all these bugs can take up space and grow. Ehrlichia, Anaplasma, Bartonella, and they cause weird symptoms. People with babesia, they get short of breath. They climb 3 steps, and they're huffing and puffing, okay? Or they get drenching sweats for no reason, and they're not menopausal. People with Bartonella will get stria. They'll get like stretch marks, and they're not overweight. And so that's where I'm talking about. These are really weird symptoms.
So these are all under the Lyme umbrella. Is that what you're saying?
Yeah, we call it biotoxin
Okay.
or Lyme disease
Biotoxin
umbrella. Yeah.
Symptoms can all still be similar, right?
Oh, there's a lot of overlapping. A lot of overlapping.
Okay.
And so, and it's just teasing those things apart and trying to prove that it is actually. And there are tests we do. We do a questionnaire. The Horowitz questionnaire from ILADS is 72% sensitive. That's more sensitive than the Western blot test.
I was just going to say, than the Western blot.
We do a visual contrast study where we look at black and white dots, and that can tell us if there's endotoxins affecting your brain. We do brain MRIs, And we can look at different parts of your brain, and there's a protocol to follow, that if this part is swollen but this part is contracted and this part is different, that it leaves almost a thumbprint of this looks like a Lyme brain versus this looks like a mold brain. So there are other ways of getting to the heart of what's really causing this, because mold and Lyme can overlap and cause a lot of the same symptoms.
And with, I mean, at the end of the day, these symptoms are not, you don't want to live a life of these symptoms.
Oh God, some people don't lose their life, but they lose the life that they knew.
Yeah.
And by the way, that's the important thing you need to know. You can get rid of Lymes. You can eradicate it. People think once you got Lyme's, you're hosed, you got it for life. You don't. You don't. And so there are a lot of people, if you catch it earlier, you're much more able to get rid of it either with natural therapies or antibiotics or a mixture of both. There's different ways to treat. There's a host of different ways to treat it. But even if that gal that we just saw, if her biotoxin stuff comes back positive and she's had this for 30 years, do we need to rush to give her minocycline or doxycycline? No. First, you got to fix her gut and her immune system and work on her lymphatic drainage and support her adrenals and support her thyroid. Because you take somebody that feels lousy and you just slam them with heavy antibiotics, you could make them feel worse.
Absolutely.
So depending on the course, now that's different than the guy that comes in and says, I was at Red River Gorge this weekend and I got home and found this tick and it was really engorged. And he has an acute story.
Yeah.
Well, that we're going to slam him with antibiotics.
Then
so
antibiotics.
we're going to put him on minocycline. So
Okay.
doxycycline is often what you'll hear. I like minocycline better because it causes less gut disturbance and it penetrates into the brain better.
Okay.
You could use doxy. I tend to use minocycline, but you're going to hit them hard with an antibiotic for at least 4 weeks.
Wow.
4 weeks, not this 2-week stuff. It's not enough. You got to hit it for 4 weeks. And then we're going to do other things that stimulate his immune system to rally with the antibiotic to have an impact.
So it is pretty rare that I've seen you put someone on antibiotics because, like you said, most people don't come in with the tick in them. It's usually
I've had these symptoms for 10 years and nobody can figure it out.
So that's why you wouldn't rush to antibiotics at that point, because
Depends on the patient.
Depends on the patient.
We don't rush to antibiotics if somebody has a chronic setting because you've got to prepare them for the die-off of those bugs.
which is that the Herx reaction?
Yeah,
Which
that's
is
a Herx
it can
reaction.
be
So a Herx reaction means I've had this infection for 10 years
Okay.
and my body has got this bug everywhere. It's in my liver, it's in my brain, it's all over the place. And if I begin to just wipe out that bug and kill it with antibiotics, those bugs are going to spill their toxins into your body and you're going to feel like the worst flu you've ever had. Headaches, nausea, joint ache,
so
no
Lyme dies
energy.
hard. It's not a quick death for the
Yeah, and so we want to kill them, but
Yeah.
we want to kill them in a controlled fashion where your liver is ready, your gut is ready, your lymphatics are ready to take the toxins and pull them out of your body and get rid of them so you don't get that Herx reaction. It's an involved process, and
Yeah.
it can take weeks, months, sometimes years to eradicate Lyme in a patient.
And so I've seen your priority with some of these patients coming in be the gut to start with, like you said, to help
Yeah.
detox them. And after looking at so many of your treatment sheets with these Lyme patients, every treatment sheet is different that I've seen you treat with Lyme.
They're all
And-
different, and
I mean,
everybody's reactions,
everybody.
and there can't be just one protocol. One protocol doesn't work. But we often blend things. We'll blend traditional antibiotics with more natural elements. I have some people that walk in the door going, I don't want an antibiotic, I want to do this all natural, and we can.
Okay.
So we try to meet everybody where they're most comfortable, but oftentimes we end up blending,
Blending, okay.
and everybody's different.
Yeah. Well, I think we covered just about everything. It's kind it's kind of a lot.
We covered Lyme in 20
We
minutes.
covered Lyme in 20 minutes.
If you have any questions, please. I should have said this at the top of the conversation. We want a dialogue. We want to hear from you your questions. Don't be embarrassed. We're not going to read your name if you don't want us to. But we know there's a lot of questions. There's a lot of confusions. And I'll say this about that. Even if you took all the well-trained, wonderful, well-intended physicians in this community, and we have lots of really smart docs, but if you're not Lyme literate, if you haven't studied the paradigm of Lyme and you're going based on what you learned in medical school, boy, you're in kindergarten, okay? So a lot of good docs out there, they're smart, but they don't know the ins and outs of Lyme, and it can be a very different tale. So just realize that there is a disconnect.
Yeah.
And so if you've been told you don't have Lyme, you can't have Lyme, I tested you for Lyme, and you still think you might, you should trust your gut. You should trust your gut and get assessed by a doc that's consistently around Lyme's patients and understands the paradigm better.
And your
Okay.
approach, it seems, it's not just here, take X, Y, or Z, but it's the whole picture of, like you said, supporting the adrenals and the gut, which I think that's why our Lyme patients are so successful, because it's not just here, take this.
You have to
It's the
support their
whole
energy
picture.
system and their detox system.
Got to get them to sleep and change their diet. I mean, it's a whole ball of treatment, not just one thing.
And you've picked up on Lyme's multiple times. Chelsea has seen a patient and just went, I don't know what's wrong, but something ain't right, and I think it might be Lyme.
I've had a
and
few.
You've been right more often than wrong, because something didn't make sense.
Yes, especially after a few weeks of just, normal, taking the weed out, taking, probiotics, and usually people get better by then, but there's always that patient you just have this gut feeling. So you can make headway and you can begin to change the gut, through the diet, but there are some just weird symptoms.
You've gotten very Lyme astute.
I've got the Lyme nose now. I had a patient a few years ago. She said she couldn't curl her hair. It was so bad she couldn't raise her arm to curl her hair. So, I mean, just odd symptoms like that.
Weird,
and she was
right?
my age. Yeah, that is weird.
And she probably hesitated to tell you that because she felt embarrassed.
Yep. And when she walked into my room, the door frame, kind of looked like it wobbled. And, again, she was my age. And I thought, this is just odd. This is not a typical, thing. Doesn't add up. Yeah. Symptoms. Doesn't add up.
So. Cues?
So we do have some questions. Isn't that great?
That is awesome. That's why we're here.
So this person was diagnosed with Lyme, high EB virus, heavy metals, Candida. I said that right?
Candida. Yep.
Perfect. Even better.
He's not a medical person. Give him a break.
Candida.
Latest test showed Lyme went negative. Only Lyme. Everything else, EB was very high. And how do you get rid of the EB virus?
You strengthen the immune system, because the Epstein-Barr virus, the EB, the Epstein-Barr virus, the cytomegalovirus, viruses don't have much of a chance against a robust immune system. You've heard of people getting mono. Mono lasts 4 to 6 weeks, then it goes away because your immune system says, hey, you get out of here, and you fix that. So if Epstein-Barr virus is persisting, then it makes me wonder the strength of the immune system, and it makes me wonder if there isn't still Babesia, Borrelia, or some infection there that's continuing to weaken the immune system. So the question I have, and this isn't a fair dialogue because you've asked me a question and we can't exchange information, but when you tested Lyme negative, what test was it? If the Lyme test is negative, that's great, but if you still have symptoms of Lyme, if you still have neurologic issues and headaches and mood swings and gut issues and migratory joint pain, if you have the symptoms of Lyme, I'm going to trust your symptoms more than I trust a negative Lyme test. If you can't get rid of Epstein-Barr, then your immune system needs strengthened. There are some things that are antiviral. Things like monolaurin is an antiviral. It's been shown effective against Epstein-Barr. It comes from coconut. It's a natural element. It's not a drug. There's something called Amazon A-V. That's a South American herb that's been shown to be very effective against viruses. So there's homeopathics. We have a homeopathic for Epstein-Barr. There's ways of going after EBV all by itself, but we would want to incorporate that into the bigger picture.
All right, very good. There are many wives' tales out there about how to remove ticks.
Oh, we didn't touch on that. That's the one thing
we missed that one.
Yeah, how do you
Good
remove
question.
that? With a tweezer, I would
With
think?
a tweezer, simple tweezer. Now here's the key. Don't just grab it by the butt and squeeze it, because you could potentially squish more of its contents into the wound, etc. What you really want to do is if this is the tick attached, you want to come in with your tweezers like this at skin level, very low, very low. Get the head. I know it's gross, but you want to get as close to the skin, get that head, and slowly, slowly, slowly traction, pull, pull, pull until it comes out. If it leaves some parts behind, you have to go into tweezers and try to pull out those parts, okay? That's simply how you remove a tick. The question comes up, well, then I should put it in an envelope and mail it to somebody and they can tell me what's in the tick. You know what? I've talked to a lot of my colleagues about that. I don't know very many docs that are doing that, and Sam Shore asked his opinion of that. He's a president of ILADS, pretty smart cookie. Sam's got a lot of experience. He doesn't test ticks because, first of all, is the lab sensitive enough to pick up on something? Is what's in the tick in you? We just can't tell.
Yeah.
So I don't know that testing ticks is that valid or valuable, and the cost can be prohibitive. It can be a few $100s, upwards of $500, $600 to test the tick for all the different things you're interested in. So I don't typically test them.
All right, next question. Last week's topic, CBD oil.
Yes.
So, recently diagnosed with fibromyalgia and a lot of pain, and nerves vibrate throughout the whole body. what do you suggest for the oil? How many drops a day should they look at using?
You should let your Lyme doctor tell you that dose, because I'm worried about you. If you've got vibratory sensation and you're diagnosed with chronic fatigue or fibromyalgia, fibromyalgia is just the medical way of saying politely, I don't know what's wrong with you. Okay, so fibromyalgia, I know it's out there and I know it's a diagnosis, but there's no one cause of fibromyalgia. Oftentimes it's low thyroid status in combination with detox issues, in combination with other things. But when you say your body has vibratory nerve issues, you begin to tickle the concern or the possibility of Lyme. Having said that, I use CBD oil on a lot of my Lyme's patients because it does. It helps with the pain. It keeps the brain calm. It helps them to sleep. Remember the impact it has on the brain, all those CB1 receptors. So depending on the concentration of your oil, I would start with easily 5 to 10 milligrams, but it wouldn't be unheard of for you to need 40 or 50 milligrams a day if you're really having neurologic issues. So I would start around 10, go to 20, try 30, see how you feel.
Might not fix the root cause.
Yeah, you have to look at your dropper and see how many milligrams is it per drop. Okay, but you're right, it's not going to fix the root cause, but it does stimulate the immune system. We have CB2 receptors in our immune system, so it does drive a healthier immune system.
All right, just wrapping up on the questions.
Yes.
So can Lyme be passed during pregnancy?
We missed that too.
Yeah.
Such a bad interviewer.
Oh, you did great. Yes, it can. So it can be passed in utero. Mother can have it and pass it on to the fetus. There's other questions. Can it be passed in sexual contact? We don't know. There's suspicion there, but it's not been proven.
What about eating meats? Like if I eat that deer that
Excellent.
just
So
walked
if I go
by.
get that deer and I eat him, can I get it? No, you're not going to get it from eating deer or eating squirrel unless you're eating it raw. I don't even know if anybody's ever tested that. But no, you can eat your deer, you can eat your squirrel, and you're going to be just fine. So it's not passed sexually that we know of. It's not passed from human to human that we know of. Some think it's passed by mosquito. It's been found, Borrelia has been found in mosquito. We don't have, I think, endpoint studies enough to make clinicians convinced that a mosquito bite can carry it. But there's a lot of suspicion in the Lyme community that other vectors exist besides ticks.
So last question. What if I'm concerned about potentially having Lyme or any other issues? What should I do? How can I reach out to you guys? What's a good way to contact?
Well, simplest way, if you have a question, if you like using email, help, H-E-L-P, help@hubertpm.com, comes into our office and we go through those emails. Call our office, which is area code 513-924-5300, and just share with my staff that you think you might have Lyme or you have concern for Lyme, and they'll set up an appointment. And you can meet with Chelsea, you can meet with me, and we'll begin that conversation, because it starts with a conversation, and then we get into testing, and then we can figure that out. Those are probably the two easiest ways to engage with us.
I think patients are surprised how fat or how better they can feel in such a short amount of time. I don't want to set that expectation up, but
great.
they
Yeah,
can.
set me up for failure.
In 2 weeks you'll feel better. No, but I mean usually with, I don't know, this is just a ballpark, but maybe 6 months you can begin to start to feel better, if not sooner.
We've seen people get better in 4 to 6 weeks, just depending. But again, it's because we're looking at the whole thing. If you have Lyme, we're not going to just treat Lyme. We're going to treat your adrenals and your energy systems and your thyroid and your gut, and that's part of the issue. And you've got to treat that part. We have had people on both ends of the spectrum. We treated Ford. Remember Ford? We put him on the natural protocol, and within 3 months he was like, raised from the dead and felt so much better, and he's been awesome ever since. We have other patients that, God bless them, we've been treating them for 2 years and we're making incremental progress, but it's slow. But I would say most people, 3 months, 6 months, pretty significant change. It's not something that happens overnight, and where we're really helpful is those people that have acute exposure. If you just got bit by a tick and you're like, oh my gosh, I want to make sure I do something definitive to stop this before it starts, that's where I'm really going to be aggressive. Okay?
Perfect.
Hey man, great conversation.
Woohoo.
I know we stimulated your brains. I know there's questions out there. You just didn't know how to formulate them, or you didn't want to put them out there. Email us, help@hubertpm.com. We'll put it up on the Facebook. Your questions are what drive other people to understand better what we're looking at. So thanks for the questions we got. I think it's a good discussion to have.
Hot
If
topic.
and if you've got a concern about yourself or somebody you love or know, then have them reach out to us. We want to help. All right? We'll see you next week.
Take care.
Take care. Bye now.